2, 1. Good morning, everybody. Welcome to another edition of Sports Medicine Weekly here on this Saturday morning. So happy you're along for the ride. I'm Steve Cashel, Chicago Bulls radio host, joined by Dr. Brian Cole, my co-host. He is the head team physician for the Chicago Bulls, co-team physician for the Chicago White Sox, sports medicine specialist, orthopedic surgeon at Midwest Orthopedics at Rush. Dr. Cole, how are you?
I'm doing great, Steve. Great to see you.
Good. Well, we're going to kick off this show talking a little bit about the latest in sports medicine science. We like to do this from time to time, and I understand that you guys had a high-level NHL player, can't say the name, but who had a cartilage bone transplant from a donor. That's interesting. Yeah,
it's we've been doing this since, in some degree, since the 1980s, but at a very high level now. I mean, I think we're almost 900 patients that have been treated with these cartilage bone transplants from other donors, right? But what's more interesting is, all of this show is that we've recently determined that we can treat very high-level elite athletes with a complicated problem with cartilage loss that otherwise doesn't have a lot of options. So, it's not common in the scheme of things, but when you add it all up over the years, there's a number of institutions that have had growing experience in supporting our ability to do the things we do for the everyday person who wants to be active and transfer that technology to people who are really trying to get back at an extremely high level.
Let's bring on our first guest. Rachel Frank is a medical doctor with the director of the Joint Preservation Program and assistant professor at the University of Colorado School of Medicine, talking about complex knee and shoulder surgery. And Dr. Frank, thanks so much for joining us. How do you use allograft tissue during surgery?
Well, first, Steve and Dr. Cole, thanks so much for having me on the show. Definitely an honor to be chatting with you both. I would echo Dr. Cole. There's a lot of great techniques that we have to treat the everyday athlete as well as high-level athletes, and using allograft tissue is one of those techniques. We use allograft tissue almost every day in surgery in some way, shape, or form, whether it's through donated tissue for an ACL reconstruction or a meniscus transplantation, or, as Dr. Cole was mentioning, using a donated piece of bone and cartilage to replace a damaged area of bone and cartilage in a patient. And the really important and interesting thing about this donor tissue is it's someone in some family who's chosen to donate this tissue just like they would an organ such as a heart or kidney, and we're utilizing this gift and really impacting lives on a daily basis. And so allograft tissue is used all the time in athletes and in non-athletes alike, and it really does change the way we can treat our patients.
What kind of injuries would benefit from an allograft?
There's a variety of injuries that can benefit from allograft tissue. In sports medicine, among the most common injuries are patients with ACL tears, because we commonly use donor tissue or allograft tissue to replace the torn ACL when that's appropriate, and that's growing in popularity with really good data to support its use for the right patients. And then another area that we often use allograft tissue is for that patient with cartilage loss, where 20 years ago there was really no good solution for this, and really young patients had really bad joints. And now, with novel techniques, a lot of which have been developed at Rush and popularized at other areas and other institutions around the country and world, we can use fresh pieces of donated cartilage and bone and replace areas of damaged cartilage and bone, and you really have essentially a new joint, no metal, no plastic, and a really high-functioning person can really enjoy their life in sports once you treat that injury.
Dr. Frank, I know that you've been involved with some research, and we've had the opportunity to collaborate on a number of projects. And you're in sort of cartilage country, being in Denver and Boulder, given that's where JRF is, who's also been a long-standing sponsor for this show because of the research interests. Maybe share some of your experience and what your thoughts are on where we're going. We're doing well with cartilage transplants, but we're always looking to do better. And just maybe share with some of our listeners where some of the evolutionary ideas are that we're trying to solve how we're trying to solve some of the problems that we still have.
Absolutely. I think the technology is great, but there's certainly room for improvement. I think companies like JRF, but also great researchers and surgeons and clinicians trying to improve outcomes for patients are always putting their heads together and figuring out where we're going. And some of the new and novel technologies include using autologous biology, essentially, so we can use cells from our own bodies to help make these bone and cartilage transplants even better, potentially improve their biologic ability to incorporate once we put that transplant in. Novel techniques in terms of the implants and the instrumentation are always making it easier to do the surgery. There's been a lot of recent developments with off-the-shelf osteochondral allografts, meaning allografts or donor bone and tissue that's available at the point of care. Because these gifts are so rare and they're so precious and we need to make sure we utilize them, we're always looking for novel ways to try to get other resources and other opportunities to transplant this tissue. And so I think one area that's really developed over the last several years is some of the off-the-shelf osteoarticular allografts. And so those are made possible, again, through donation, but through some of the novel techniques with preservation and storage, we're able to even transplant more of these pieces of bone and cartilage into patients.
Amazing stuff, the latest in sports medicine science. Dr. Rachel Frank. Thank you, Dr. Frank, for joining us.
Thank you so much for having me. Have a great day.
Perfect. Awesome. That was